Breast cancer, carcinoma of the breast. It is the most common cause of death in women in the Western country. In UK, 1 in every 12 women will be developed the disease during their life. يعني كلش common in UK and United States also. كل 12 women واحدة من عندن may develop the carcinoma during their life. كلش common disease in the Western country, and became also in our country common problem in the female. It is the second most common carcinoma in female. The median age is about 47 years of age. In Iraq, the breast cancer account for 25% of all cancer. من مجموع كل type of the cancer بالعراق 25% هو breast carcinoma. Carcinoma in one breast increase the risk of developing carcinoma in the other breast in about 3 to 4 times. يعني إذا واحدة عندها breast cancer in the right, after treatment of the right, the second breast, the left breast, liable to develop the tumor in about 3 to 4 times more than the normal woman. يعني أكثر من البنية اللي ما عندها من المرأة اللي ما عندها breast cancer. If we have right breast cancer in a female, the left breast may develop the cancer more than the normal person, normal woman, and 3 to 4 times. 3 إلى 4 مرات أكثر من المرأة اللي ما عندها أي type of breast cancer. The incidence of bilateral carcinoma is about 2%. Etiology, طبعا exact cause of carcinoma of the breast is not well known, but we have certain precipitating factor and certain etiological factor. First, geographical distribution of the tumor among the Western country more than the developing country. And it's more common in Western country and account for 3 to 5% of all death in women, while it account for 1 to 3% of death in developing country. Second, the age. It's rare below the age of 20, but it is at the age of 90 reach up to 20% of the women will be affected. يعني ويا تقدم العمر الريسك of the carcinoma of the breast increase in the female مثل ما هو carcinoma of the prostate in the male and increase with the aging of the patient. يعني بالنسبة ل prostate at the age of the 90, the patient may have prostate in 90%. Okay? In the female, the carcinoma of the breast risk increase up to 20% after the age of 90. 6, طبعا the male may be affected with the breast cancer in about 0.5%. يعني من كل 200 male, 1 may develop in 1% there is a risk of carcinoma of the breast in male in the population. The genetic factor, more in female with positive family history of specific mutation responsible for 5% of the breast cancer only. And the gene responsible may be BRCA1 or BRCA2 gene. Yani the familial breast cancer, only 5% of the breast cancer in general. Yani 95% of the breast cancer is not due to gene. يعني هواي نسوان تخاف من البريست كانسر تعتبره مرض وراثي. Only 5% لحد الآن proved to be due to genetic factor. The diet, because it's more common in the Western countries, so the dietary factor may be a cause. High intake of alcohol اللي هي ما موجودة احنا عندنا طبعا may carry a risk. Diet with low in phosphoestrogen increase the risk. Diet low in the vegetables and green vegetables, more fatty diet, more liable to develop the carcinoma. Endocrine as a cause for the carcinoma of the breast, increase risk in the nullipara. يعني مريضة من زوجة ما صار عندها أطفال, there is risk of developing breast cancer أكثر من الوحدة المتزوجة وعندها أطفال. Obese carry a risk because they increase risk of conversion of steroid hormone to estradiol to the estrogen, and this may be a risk of carcinoma of the breast. Or the patient receive exogenous hormone, like the inpatient with oral contraceptive pills for a long time, for more than 10 years. يعني وحدة تاخذ مانع حمل contraceptive pills أكثر من 10 سنوات, there is a risk of developing breast carcinoma. Breastfeeding may be a protective for the carcinoma of the breast. Breastfeeding may be protective for carcinoma of the breast. And those female that breast their baby, there is less risk to develop the carcinoma of the breast. Female with first baby in early age is protective. يعني وحدة تتزوج وهي صغيرة وتجيب الطفل وهي صغيرة, there is less risk to develop the carcinoma of the breast. Or the patient have a late menarche early menopause, يعني معناه reproductive life معناته short, يعني early late menarche early menopause, يعني يصير تجيها الدورة الشهرية late, يعني مو بعمر الطبيعي, عادة تجي بعمر 11 أو 12 سنة, هي تجي مثلا 13 و 14 سنة ويصير عندها menopause بعمر 40 أو 45. This is a short reproductive period. Those patients with short reproductive period, they have less risk of developing carcinoma of the breast. Or the patient have previous radiation to the chest, مثلا due to patient with Hodgkin lymphoma who receive radiotherapy for the chest, or those patients live in the area of nuclear bomb that may be a cause for the carcinoma of the breast, or even carcinoma of the thyroid gland. Papillary carcinoma of the thyroid, more common area we have nuclear bomb pollution in the environment, مثل ما صار في ناكازاكي وهيروشيما في الحرب العالمية الثانية, أو انفجار اللي صار في المعامل النووية في تشيرنوبل في أوكرانيا. شافوا risk of carcinoma of the breast and carcinoma of the thyroid increase due to pollution of the environment with the radiation. Now, the risk factor for breast cancer can be enumerated like that. Breast carcinoma in the first degree relative, which carry about only 5% as a gene responsible for the developing of the carcinoma of the breast. Second, breast carcinoma in the contralateral breast, 3 to 4 times more a risk. Patient with BRCA1 and BRCA2 gene mutation. Obesity and alcohol intake also may carry a risk. Nulliparity may be a risk, and early menarche and late menopause, يعني wide reproductive life of the patient, carry risk for carcinoma of the breast. Pathological type, the tumor, the carcinoma of the breast arises from the duct system or from the granular acinar tissue. If it arises from the duct, we call it duct carcinoma. And if the tumor is just intraepithelial, not breaching the basement membrane, we call it carcinoma in situ. Carcinoma in situ is an intraepithelial type of cancer that not breaching the basement membrane, and it's very early sign of carcinoma, early type of carcinoma of the breast. The grading of the carcinoma of the breast into well and moderate and poor differentiating according to the cell within the tumor. If the cell look like the mother cell, well differentiated. If it is not like the mother tissue, it's poorly differentiated. If it is between, it's called moderate differentiation. The more well differentiated the tumor, the good is the prognosis. كل ما يكون differentiation is more, the prognosis is better. The pathological type of the carcinoma of the breast may be duct carcinoma is the most common type, maybe lobular carcinoma, and account for about 15% of the breast cancer, which may be multifocal or multicentric involvement of the more sector of the breast, as you see in the picture here. If it is multifocal, معناه in one quadrant of the breast we have two foci for the malignant cells. But if we have the foci of malignant cell in more than one quadrant of the breast, we call this multicentric growth. And it may be bilateral. We have two types, maybe classical type of lobular carcinoma of the breast, which is of good prognosis, or maybe atypical or polymorphic type, which is of bad prognosis. مثل ما تشوفون بالصورة here in the picture, we have multifocal in same quadrant, multicentric in different quadrants. Colloid and tubular carcinoma, these are rare type. The important type of carcinoma, pathological type of the carcinoma of the breast is the inflammatory carcinoma of the breast, or mastitis carcinomatosa, which is very rare, but it is aggressive, and the patient presents with painful mass, swelling of the arm, with cutaneous edema and warmth and hotness, look like the inflammation, with the blockage of the subdermal lymphatics by the carcinoma, and involve 1/3 of the breast, and it looked like an abscess. Patchy disease of the nipple. This is a superficial manifestation of the breast carcinoma, presented with eczema-like condition involving the nipple and the areola, with destruction of the nipple and areola, and usually unilateral, and the nipple completely eroded or destructed. And microscopically, we have a large ovoid cell with abundant clear cytoplasm within the Malpighian layer of the epidermis. And how you differentiate between the eczema and the patchy disease of the nipple? من هذا الجدول نقدر نميز بين patchy disease of the nipple and eczema. In patchy disease of the nipple, we have unilateral involvement of the one breast, while in the eczema may be bilateral. In the patchy disease of the nipple, we have the edge which are distinct, yani clear edge mounted disease, while in the eczema the edge is not distinct and not clear. The itching is absent in the patchy disease of the nipple, while the eczema we have itching. Seen in the patchy disease of the nipple, we have the tumor within the patient with menopause, an old patient, while the eczema occurred during the lactation and young age group. We have vesicle in the eczema, but we have no vesicle in the patchy disease. The nipple and the patchy disease usually destructed, eroded, and sometimes absent, while in the nipple and the eczema is intact and not destructed. And the patchy disease of the nipple, we have a lump underlying the destructed nipple, while in the eczema we have no lump. These are 7 points to differentiate between the patchy disease of the nipple and eczema. مثل ما تشوفون بهاي الصورة, the left breast without nipple. The nipple is completely eroded and destructed by patchy disease of the nipple. In situ carcinoma, as we mentioned, the carcinoma within the epithelium, intraepithelial tumor, it's a carcinoma in situ, which is a precancerous or pre-invasive cancer, which not breach the epithelial basement membrane, usually asymptomatic, and we can discover it during the biopsy for a benign disease. من ضمن البايبسي ماس مثلا شايلينه شايل شوية تشو من داير الماس, نشوف من التشو around the mass we have intraepithelial carcinoma, which we call it carcinoma in situ. It's usually asymptomatic and account for 20% of the cancer detected by screening in UK. بالسكرين by mammography you can see calcification. وإذا أخذنا biopsy نقدر نشوف intraepithelial tumor, which is carcinoma in situ. We have two types, duct carcinoma in situ and lobular carcinoma in situ. Lobular مثل lobular carcinoma, it is usually multifocal and bilateral, and that's why the lobular carcinoma treated by simple mastectomy. 20% only of the duct of the in situ carcinoma change to invasive type. Only 20% of those patients with intraepithelial carcinoma in situ, they will change to complete invasive carcinoma of the breast. The treatment for the lobular carcinoma in situ is the simple mastectomy, and for the duct, just local excision. A few points about the ER, PR, and HER2. What do you mean by ER, PR, and HER2? ER, estrogen receptor, PR, progesterone receptor, and these Both if they are positive, mean that those patients with positive ERPR, they will respond after the treatment of the patient with surgery, respond to hormonal therapy. If the patient have ERPR positive, they will respond to given to the patient hormonal therapy like the tamoxifen or Nolvadex. What do you mean by Erpr or Her2? This is a growth factor receptor. If patient have a positive growth factor receptor, this patient liable to develop local recurrence after surgery. That's why we should give to them a drug called the Herceptin, but carry a bad prognosis because there is a risk of local recurrence after excision of the tumor. How the tumor of the breast, carcinoma of the breast, spread, either local invasion to the surrounding tissue, to the pectoral fascia and pectoral muscle, or by lymphatic, 85% to the axilla, 15% to the internal mammary gland, and the other way of spreads by bloodstream to the liver, to the bone, or to the brain, to the skeletal, or to the lumbar, to the pelvic bone, and usually patient develop osteolytic metastasis in the breast carcinoma. And patient with CA breast may present with pathological fracture of the neck due to skeletal metastasis of the tumor, or visceral metastasis to the liver, lung, brain, or adrenal or ovary may develop secondaries from the breast carcinoma. How the patient with breast cancer present with painless mass with or without axillary lymph node, mostly in the upper outer quadrant of the breast in 60%, and 12 in the inner, and lower quarter in 10%, and lower inner in 6%. So the most common site for the carcinoma of the breast, according to the quarter of the breast, in the upper outer quadrant in 60%. Pain, in 10%, the patient may have breast cancer with pain due to carcinoma and mastitis carcinomatosa or inflammatory carcinoma of the breast. Or the presentation is the recent nipple retraction, not remote. يعني صار فترة قريبة صار عندنا nipple retraction. This may be a sign for carcinoma of the breast. Nipple discharge bloody, proved by the cytology not to be a malignant cell within the discharge. Or the presence of the pseudo-orange of the skin overlying the mass or sometime beyond the mass. يعني pseudo-orange مثل قشر البرتقالة due to edema of the skin, lymphatic obstruction, and the hair follicle will be retracted down, making the skin of the patient with carcinoma of the breast like pseudo-orange. Or the patient presents with skin ulceration, or the patient presents with fixation of the tumor to the pectoral fascia or to the chest wall. We call this cancer incurus, when the whole chest wall involved by the tumor and making it look like the درع. يعني يسموه cancer incurus like the درع, كان من مريضة لابسة درع من المalignant cell. And on examination of the patient carcinoma of the breast, we may have a hard mass, diffuse, not well circumscribed, and irregular surface with skin tethering seen by elevation of the arm of the patient above the head. نقول المريض رفع يديه لفوق فالبريست تنزل دي جوا ويبقى الماس attached to the skin leading to skin tethering. And by examination of the axilla, we can feel a palpable lymph node in the axilla. Prognosis of the breast cancer depends on the condition of the axilla, depend on certain factors. First, the tumor size, يعني على السtage, and the lymph node involvement على staging of the breast carcinoma. Even the breast carcinoma staging is important for the prognosis of the disease. Or what's called second, on the depend on the invasive and metastatic power or potential, which depend on the grading of the tumor. Grading, if the grading is poor differentiated, معناها very bad prognosis. Well differentiated, معناها good prognosis. Also depend on the hormonal receptor status. If we have a patient with ERPR positive, carry a good prognosis. ERPR positive and HER2 negative, very good prognosis. ERPR negative, HER2 positive, bad prognosis. ERPR negative, HER2 negative يسموه triple negative carcinoma of the breast, carry very bad prognosis for the patient. Prr, and HER2, all three negative, we call it triple negative, very bad prognosis. This is a rough estimation of risk factor for carcinoma, risk of the patient with carcinoma of the breast. We can classify them into very low risk group, high risk group, and locally advanced, or the patient with metastasis. مو كلش مهمة بالنسبة لكم بس للاطلاع. Staging important. Staging of the carcinoma of the breast. Stage 1, if we have طبعا this is staging depending on the T اللي هو tumor size, N condition of the lymph node at the axilla, M معناه metastasis, distant metastasis. If we have stage 1, we call it T1 N0 M0. What do we mean by T1? Tumor with size less than 2 cm. N0 معناه there is no axillary lymph node. M0 معناه there is no distant metastasis. Stage 2 معناه T2 N1 M0, mean the tumor size 2 to 5 cm with mobile axillary lymph node at the same side of the tumor with no distant metastasis. إذن stage 2 هو T2 N1 M0. Stage 3 انقسم إلى قسمين. Stage 3A, which T3 N2 M0, معناه the tumor more than 5 cm with fixed lymph node in the axilla with no distant metastasis. Or the stage 3B معناه T4, any size of the tumor. T4 معناه any size tumor حتى لو صغير أو كبير مو مهم, with the presence of the ipsilateral supraclavicular lymph node involvement. يعني نفس السايت. مثلا افرض the patient have CA breast in the right breast, there will be fixed axillary lymph node at the same site. Also involvement of the lymph node in the supraclavicular site of the breast. يعني the right supraclavicular space we have lymph node involved by the tumor. This is called stage 3B. Stage 4 mean either we have M1, مو مهم T1 N T1 N هنا مو مهم إذا كان عندنا M1. يعني sometimes the patient present to you with M1 قبل M1 and for the small mass in the breast بنشيكه, بينما هي تجينا pathological fracture of the neck of the femur, or compressed fracture in the vertebra, or the brain metastasis or liver metastasis. بعدين نسوي له checking for the patient, شوف the site of the tumor. Primary site of the tumor is the breast, and the other site was where the secondaries in the brain or in the bone or in the liver or in the lung. These are secondaries. The primary site هو breast. إذن هذا هو M1. stage 4 maybe غير M1, maybe patient with bilateral breast cancer نعتبره أيضا M1. Patient with local recurrence نعتبره M1. Patient with contralateral axillary lymph node involvement, يعني CA breast in the right وعنده lymph node in the left, معناه نعتبره stage 4. Patient with cancer recurrence, يعني tumor invading the pectoral fascia and fixing to the chest wall, معناه this is carcinoma with stage 4. إذن stage 4 carcinoma of the breast either M1 or bilateral breast cancer or local recurrence or contralateral axillary lymph node involvement or lymph node involvement or cancer recurrence. هذا ملخص للستيجات. TIS معناه كارسينوما ان سيتو, هذا ما مهم. T1 stage 1 هو T1 N0 M0, stage 2 T2 N1 M0, stage 3A T3 N2 M0, stage 3B T4 N3 M0, stage 4 هو M1 bilateral local recurrence contralateral axillary lymph node involvement and cancer recurrence. هذا advanced carcinoma of the breast with fungating tumor involving the upper outer quadrant of the breast. هذا mass in the upper outer quadrant here. هذا diagram وهنا الصورة الحقيقية للtumor in the upper outer quadrant. This is a large mass, fungating mass. This is pathological fracture of the humerus due to osteolytic lesion and caused by the metastasis of the carcinoma of the breast to the bone. Skeletal metastasis of the carcinoma of the breast to the bone, also involving with the pubic bone by osteolytic lesion due to carcinoma of the breast. شكرا.